A respiratory virus is on the march in New South Wales. Infections of hMPV likely to outpace influenza and COVID this spring. And there's no medical treatment or vaccine for this one either. Kenny Heatley is live for us in Sydney this morning. So what are the symptoms here, Kenny?
Human metapneumovirus, Pete. Symptoms very similar to influenza and COVID, shortness of breath, cough, fever, nasal congestion. It can morph into pneumonia and bronchitis and become quite severe, and in the most severe cases it can be fatal, particularly in children under the age of 5 and people with weakened immune systems. New South Wales Health PCR testing data shows that in the past 2 weeks, in the first week you had 648 cases, and in the last week 1,168. So quite a sharp rise there. Factor that in the influenza cases after the winter peak are falling off, and we're seeing this rise. And generally hMPV tends to see an increase each year around late winter and early spring. Here's more from an expert, Professor William Rawlinson, on Sky News.
It's probably moving fast because we're back to normal, if you know what I mean. The masks have gone. People hopefully are still washing their hands, hopefully staying at home if they've got a respiratory illness, hopefully coughing into their elbow and doing those things. But you're still seeing more spread, less masks, and so the spread's occurring. And this is the usual time of year that we do see metapneumovirus, as well as things like RSV and those other respiratory viruses that have names.
hMPV was only discovered 23 years ago, so it's a relatively new virus. There's no treatment. All you can do is stay at home and rest up, and there's currently no vaccine, Pete, but Moderna are working on a mRNA-type vaccine, but it's in trial phase at the moment. Probably won't be ready for at least 3 to 4 years.
OK, Kenny Heatley, thank you.